Hello, how are you doing? My name is Deron Cloud, and I am here as I am. I am the pastor of the Soul Factory and church in Washington, D.C. and Atlanta, Georgia. And I'm a part of the new ministry of health. I just want to take a moment to give you an understanding as to what is the new ministry of health and what is the mission and what we're attempting to do. It has come to me that we hear all these numbers in the media, in the news, and many of us feel that we're statistics because people are not really paying attention to what's really going on. Marvin Gaye did a song that said, "What's going on?" And I began to ask, why did he write the song, "What's Going On"? Because during that time, the culture of fear was taking place and people were going through a lot. And he wanted to know what's going on. And if you are a healthcare patient, if you are a caregiver, if you are a doctor, if you are a nurse, if you are a healthcare practitioner, if you are a doctor's assistant, whatever it is, you know that there's something drastic happening in our healthcare system. And I want you to understand the goal is, and it took me a while to get this because at first I was just thinking that it was just me. But then I realized we're all in the same boat. And yes, we may do different reports on different ethnic groups. This ethnic group is going through this and this ethnic group is going through that. But what I found out is that we're all in the same boat, because when we have a medical crisis, the only way out is through. And you've got to go through something to get to your breakthrough, to get to wellness. And it's time for all of us to work together. And when I say all of us, the new ministry of health is about learning to take this grind, this journey to wellness for your spouse, for your loved one, for your child, for your mother, for your father or a relative or someone who's sick and shut in. And the whole purpose of this is to be able to help us, equip us with the information and the wisdom we need to handle this trip. And it is a trip. Anybody who knows about pain and suffering and just having to find your way, you know that this system can be blinding. And so when you hear the new ministry of health, it's a movement where we're saying we've all got to work together. The entire community has to come together. And when we work together, what's going to take place is that we're going to find solutions to inform you, to impart wisdom, to give you knowledge, so that you are no longer in what I call the no man's land. Because the new ministry of health is about the person who has to sit in this sterile white office and try to figure out what in the world is going on. Now, a lot of times, unless you are a single father, you don't know this. And so I don't want this to be sexist, and I don't need no hashtag Me Too letters. All I need you to understand is that you, as the woman, the mother, you all are the gatekeepers of the healthcare system. You are the ones who know all the information about your child, about your spouse, about your significant others. And often, and because I have been in the hospital, and when I say been in the hospital, I want you all to understand what qualifies me for this new ministry of health. Because I was diagnosed with lung cancer in 2012. And when they told me all the stages that I was in. And I don't get into all that stuff anymore because I'm no longer the diagnosis. It's my choice. And so literally while I'm in the hospital going through all the different things, I learned that if you don't take control of your health, you're in trouble. And when I get there and they tell me you've got the choice of radiation or the choice of chemotherapy, I don't know what to do. So the new Ministry of Health will constantly be spotlighting, secure my medical records. And if you look at any of the reports that are out there right now, we have found out that our medical records are not secure. And what you need in the new Ministry of Health is about you having the proper materials on your phone or on your tablet, whatever it is, so that you can operate in such a way with integrity and have knowledge. And so we will then end up transitioning. And so when I tell you I'm qualified, I want to talk about what I've had to experience because it was in my chest and then it metastasized to my brain. I needed help. I needed answers. And I needed wisdom. And I was terrified. And so the new Ministry of Health is about bringing you comfort to know that you're not alone. We're all in the same boat. And if you have a health challenge, you're in the same boat. If you have pain, you're in the same boat. There ain't no such thing as black, white, brown, green, or it's no such, I don't even say green because that's not a color. It's no such thing as ethnic only pain in a certain group. We're all in the same boat. The green means that what matters is the money. And what we have to do is now give you the wisdom so that you can lower even your health care cost. Why? Because it's breaking us. Now, the new Ministry of Health is to bring comfort because let me just tell you, I had a medical professional ask me just 3 days ago, how much are your bills? What do you have to pay per month for medication? I had to stop just like that and say, if I had to pay out of pocket, just the cancer meds alone is $14,000. By the time everything else, it's 20-something thousand dollars. The new Ministry of Health is about the people who have been broken, who have been reduced, who have played by the rules and got, I call it screwed. Not screwed, but screwed, meaning you played by the rules and this is what happened. And so what we'll be doing on each one of these segments again is equipping you so that you don't go through this trauma and talking about the different things. And I want to talk to you all today, and I'll take a break in a second, but I want to talk to you all about the gatekeepers. Had it not been for my wife being the gatekeeper and the caretaker, I'm not here. Because when you're reduced to nothing and you're reduced to having to take care of yourself, you need help. So this will be, these segments that I will do today will be about taking care of yourself and also the caregiver, helping you with what we are going through. If I use my notes, I want you all to understand that I'm currently in my own trial. And what I decided was to use my suffering and give meaning to my suffering. Viktor Frankl, one of my favorite artists, and that is, he says, man's search for meaning. The new Ministry of Health is the way I give meaning to my suffering and help anybody else give meaning so that you can make it through and do what you have to do. Now, my name is Deron Cloud, like cloud in the sky. And if you see this pendant, I'm a soldier. But I'm not a soldier of the armed forces. I'm a soldier of human forces. And that is, soldiers mean sold out, living, delivered, in everlasting righteous service. And what you're about to do is be served with righteous information, truth, so that you can do what you have to do to be able to thrive. And that means not survive, but to thrive, to super abound and thrive out of this situation. So I ask you to sit back, relax, enjoy what it is that we're talking about, and it may bring you a little bit of pain. But I want you to understand, if you have wisdom and truth, you'll be able to handle your situation. I hope that I'm able to bless you. And I hope that the guests that I have on today will be transparent enough so that we all can work together. And watch this. This ain't about demonizing doctors, because doctors are people too. And we're going to talk about the challenges they have in the healthcare system, because they too are going through pain that's indescribable. And they signed a Hippocratic oath to help. But it's hard for them to do their thing. So my goal today is to bring compassion to this movement so that we all can be on the same page. My name is Deron Cloud, and I am the pastor of the Soul Factory. I'm also part of Soldiers Outreach, soldiers-outreach.com, so that we can do what we've got to do. And then the new Ministry of Health. You're going to hear so many different things. Beacon Holistic. You're going to hear about a sister that's going to come on here. I call her the Tiger Mom because she's the first Tiger Mom I've ever met live. And I realize that title does no good for what caregivers and caretakers go through. I love you. I beat you to it. We're going to come right back, and I hope that I've been able to bless you and help you, and get a piece of paper or some notes so you can write this down. We'll be back within a second talking about this new ministry, service of health. It's the journey to wellness, the journey to peace of mind. I love you, and I beat you to it. God bless you. My name is Deron Cloud, and believe it or not, you're getting ready to experience the new Ministry of Health, where truth, God is truth, where we deal with truth, where we talk about wisdom to help to give you solutions. I have been able to be connected with a group of patient advocates, people who are about the people. It's a movement, and it's a movement of us taking back control of our health care and doing it with people who are compassionate. And it gives me privilege because of what I've gone through in my own life with what used to be lung cancer, with what used to be brain cancer that's no longer there. I've met many people, but today I have the privilege of bringing in Dr. Henri Lamothe, a lifetime professional emergency room physician for at least 30 years. And he is going to now speak with us. And I want to just introduce you all to Dr. Henri Lamothe, because this man is the man. But it'll make sense as we keep going. Dr. Henri, how you doing, my friend?
Very well, Deron. Thank you for some kind words and introduction. Thank you.
Thank you. And so we're talking about the new Ministry of Health. We've been talking about it in private for some months. But now I want people to understand, what is your passion for the patient? Give me an example of who you are, and what do you consider the new Ministry of Health?
Well, that's a fairly broad topic. You have to look inside and understand where you're coming from.
Okay.
You have to look at not just the journey, but the vision ahead. And if you spend your life with empathy, if you spend your life with the hope to seek knowledge enough to understand the human condition, both physically and mentally, then you can use those tools to hone down your character as a compassionate individual.
What is empathy for a doctor?
Empathy is the ability to try to understand the pain and suffering that the patient has. But more importantly, you're driven by finding a solution, driven by at least being an advocate for the patient, at least being a communicator to the patient. But more importantly, in a system that's fairly complex, you need to be an informant. You need to empower the patient to understand everything about his or her condition. because that condition doesn't just affect the patient. It affects an entire family structure. It affects everyone in the immediate vicinity of that patient. It affects distant relatives. It affects everyone that is part of that patient's legacy. So having understood the fact that what I'm going to do for you would hopefully be translated to what your family will do for you. So I need to communicate not just with yourself, but other members of your family, specifically in conditions that will help you facilitate through a system that is fairly complex.
Let me ask you a question. That's a great response. When you say an informant, before you walk in to talk to the family member or the patient, what kind of routine, if you do, in your mind do you go through before you walk in that room to talk to them? Is there something you think about, or do you just walk in?
You have to present yourself with the idea that within 5 seconds of walking into a scenario, whether it's one patient that has a specific medical condition in the emergency room, that you need to gain trust. The patients are scared. They're dressed down. The family members are all looking at you for an answer. You walk in with an idea of what you're going to walk into because you understand where their level of ailment is, how critical they are, how much you need to really focus on resuscitation versus education. But throughout the entire process, that becomes a very important part of gaining trust. It has to be repetitive, it has to be honest, and it has to be with a sense of, this is the way I would treat my mother or my son. That's what you have to bring to the table with every patient that you see. So in the emergency department, when the crisis hits, which is unfortunate for most because that's what happens, you need to be aware of the fact that you're going to affect not just one patient, but potentially 30 other individuals, if not more, who are directly involved with the way in which you interact with them. And I can tell you, in this day and age, with social media as it is, everybody's on their cell phones. Everybody's clicking away, even talking, even broadening the scope of the interaction with you. Your doctor says this. He thinks he's that. He may be a nice guy. He doesn't look like he's happy, or whatever it is that you bring to the table. You need to understand that you are dealing with a tip of an iceberg of a large number of individuals who are connected because they care about each other. And you need to gain that trust right away.
And that's one of the things you say. Why would you need to gain trust? And why do you say that? Because we as patients are just very suspicious, or why are you gaining trust, Dr. Henri?
It's part of the process that I call the patient experience. The patient experience has to be a bilateral communication that includes information that allows the patient to be there.
Bilateral communication. You're using big words. What are you saying?
You speak with them, they speak with you.
Okay.
You sit and listen. You give them a chance to express their fears. You give them a chance to express their concern. It may be nothing. Each one of them already Googled what may be happening. But nevertheless, you give everyone a chance to at least communicate with you, because that is a very precious part of the patient experience, at least in the emergency room.
And what do you think the patient walks away after they felt heard? She's felt heard. The mother feels heard. What do you think we walk away with?
A bad experience. An unfortunate experience. You may have treated the patient appropriately, but if you have to come over those hurdles, that makes the human condition much more difficult to treat, both psychologically and physically.
Right. Let me ask you, do you ever walk out the room and you're affected by what you just had to talk to the patient about? Because I notice a lot of times you guys have to be stoic. You, as doctors, have to be very stoic. Do you ever feel anything where you show your emotions to a patient at all, or is that a rule?
No, there is nowhere in your medical training where they teach you empathy. Either you have it or you don't.
Okay.
So you walk out of the room honest with yourself.
Right.
Let's start with that concept first.
Okay.
You need to be honest with yourself, honest with the interaction. Some are difficult. Some are very difficult topics to deal with, but you need to overcome that barrier and get to the point where you can be, at least picture yourself on the other side of the curtain, where you need to have the information that you know that will get you from point A to point B.
The doctors who helped me, both male and female, were the ones who actually sat down and let me know that they heard me and they understood exactly what was going on. And this is why I've chosen to be a part of the new Ministry of Health, because when you get on this grind of wellness, you have to have information, but you also have to have empathy and compassion. And had I had a well, I got one like you now, but had I had a doctor like you that would take that time where I wouldn't feel like I'm being rushed, I guarantee you they don't feel like they're being rushed when talking to you.
No, and it has to be repetitive. You can't just walk in there and come back 3 hours later.
And you keep saying repetitive. What do you mean?
You need to be informative across the board, because as scientists, across the emergency practice, across medical practice, you get objective data. You get laboratory exams. You get x-rays. You get CAT scans. You re-examine the patient. And the results are very important. You tell them, this is what we're going to look for. This is why we need to do it. And this is how long it's going to take. And that at least gives them a plan that we're both on the same page. That means you need to go back and tell them.
Right.
The x-ray result shows this, therefore we need to think about that.
Right.
So it's a conversation that is necessary. It's a conversation that can't be one way. And it's a conversation that at least allows them to give you an idea of how much fear they're in. Now, having said that, it's a very daunting experience to have to come to an emergency room. And some patients fear coming there, fearing that they may never walk out.
Right. And because I had to go to emergency room 4 times in 2 years, it is so daunting to walk in there. Everybody's moving around. You don't know if anybody's paying attention. And this is why I've taken on the moniker of the new Ministry of Health. And I'm so appreciative. I count it a privilege, my friends, to be able to talk to Dr. Henri Lamothe. I count it a privilege to be able to talk to somebody who has talked with people and empathized where and had empathy to where we are. And I can count it a privilege because even talking to you today brings me hope, because you're people. Doctors are people too. And you all have lives. And you are demonstrating to me that it can be done. And those people who did it, they bless me. And I just want you to know this concierge thing, and if you want to just say this, what is your passion about the concierge part of Secure My Medical Records online? Or Secure My Medical Records? What's your passion?
The part about Secure My Medical Record that becomes very important is that in addition to giving you a historical perspective of who you are medically, you can carry it all over the world. Yeah. Not only that, if you're in Europe and you happen to have an issue with chest pain, you can get the EKG that was done in Chicago a year ago to compare it to. So it becomes a very powerful tool to enhance the physician's ability to better care for you.
Right.
And a concierge service is filling a void that exists between what you've experienced when you left the emergency room, when you were in the parking lot thinking, I should have asked that question. What should I do tomorrow? And also, what's important about the concierge service is that it really understands the historical perspective of healthcare delivery system, both allopathic and homeopathic.
Right.
It is the marriage, it is the acceptance of both of the systems that may complement you to have a better experience and a better outcome with less issues that could have been prevented.
Let me ask you, how will you feel when the patient comes in, like myself, to say, can you give me my medical records before I leave here? Can you, how will you cooperate with that kind of
They're
system?
yours.
They're mine.
Yeah.
What do you mean?
You should have your medical records.
So they're mine. They're mine.
It's about you.
It's about me. See, I knew this, but I want y'all to understand. Our goal is to educate the patient, the caregiver, the gatekeeper, because no one told me that I had the right to look at those records and walk out with them. And the new Ministry of Health is about the grind to wellness and educating you on your rights to be able to do what you can do, and bringing people like Dr. Henri Lamothe into your space, your purview, so that you understand, had I had my apparatus, had I had this on me, I would not have had so much stress, because I would go to the doctor, I would check my blood pressure before I got out the car. By the time I was sitting in there, he took my blood pressure, it was up 28 points because of the stress that I was going through. But had I gone in and been equipped with this? So what he's telling me and what you're telling me is that it could be on my tablet, it can be on my iPhone, it can be on my Samsung, it can be on my computer. And what that means is that if you're a parent at 2 o'clock in the morning and you're taking your child in, and you can go in and you walk in prepared, and you would cooperate with that.
Absolutely.
Because it belongs to who?
To you.
To you. Hey, you all. I'm talking fast because this man has a lot of stuff on his plate, but he's also got a lot of people on his plate. And never in my life have I spoke to a conscientious doctor like you.
Thank you.
When you are having an existential crisis, you have to make decisions during an existential moment, and you have to have people who are educated. The new Ministry of Health is to equip everyone that when you have that existential crisis, you'll also have existential analysis. And I thank you for helping me to be able to analyze myself and what I'm going through, because even now I'm learning more. I appreciate you, my friend. I thank you for all your studies. I thank you for all the empathy and all of what you've been through, because guess what? You know what the experience is all about. Would you agree?
Absolutely. Thank you, Deron.
Now, let's let go hard. I like that. Hey, y'all, we appreciate you all joining us on the new Ministry of Health. My name is Deron Cloud, and this is
the new Ministry of Health.
No, my name is Deron Cloud, and this is
Dr. Henri Lamothe.
There you go, where we believe in the truth. We'll talk to you soon. Much love. And this is sign language. I love you, and I beat you to it.